Presentation of this ViewFinder episode is locally supported by UCDAVIS Health System.
It began with just having constant pain. The doctors early on said you have all the symptoms of fibromyalgia, but men don't get fibromyalgia. And so I would wake up in the morning just in screaming pain. All I do there is just get in there, get it dark, get it quiet, and just try to sit still and recover from every day. I'm sorry. So that time at night, you're trying to charge those batteries because the next morning you're going to face it again.
The horse bucked and sunned and turned and twisted and screamed, and finally the horse got me from its withers. It got me up and hit me, and as I went up in the air, I catapulted up and I came down on the side of the cliff. My hips had shattered in so many places that they really didn't think I was going to make it, that I wasn't going to walk again. My life just kind of went away, and the future I thought I was going to have went away too. I just thought it was going to be okay in 6 months or a year.
The first couple of years, when you're not used to having nonstop pain, it's in the forefront of your mind. It's always there, and you think, God, how am I going to deal with this? Am I going to end up having to kill myself? How am I going to cope?
We were scheduled to be on tour on the East Coast for 3 weeks and had performances that very weekend in Northern California. All of a sudden thinking, how am I going to work? How am I going to generate income? And curiously, I wasn't afraid of dying, but I was afraid of not living as fully as I felt like I was supposed to.
Their stories are all too common. Each of these people have battled chronic, near constant pain. But what is chronic pain and what triggers it? Why do people feel pain differently? Hear from the leading pain management doctors from UCDAVIS and Stanford Medical Center as we break down the facts, mysteries, fears, and psychology of pain. And we'll hear about the latest research to help those living with pain. For Phil Jenkins, it's a daily struggle just walking through this office door.
You just hurt all over. You just don't want to move.
Jenkins is like many working Americans, living with pain around the clock. He has fibromyalgia, a condition that affects between 4 and 6 million Americans.
Fibromyalgia has historically been thought of as a condition or a disease of the muscles, the tendons, the joints. What we've learned more recently is the signals that are coming in from the body are ultimately modulated, amplified in the brain. And a patient with fibromyalgia, they take what may very well be normal signals and they crank the amplifier up. Their brains are hyperwired, hyperamplified, such that normal sensations are perceived as being painful.
Since being diagnosed with fibromyalgia, life has completely changed for Jenkins. He was a ranger working mostly outdoors, but the pain got to be too much. Today, he spends most of his day indoors as the division chief at the California Department of Parks and Recreation. Living and working with chronic pain isn't something Jenkins talks about very often, and it's not easy.
My assistant, for instance, is always watching me, and so if she sees the signals, she puts a little sign on my door that says "Genius at Work." And that's a time that I can do a little bit of quiet computer work. And in order to quieten down all the sensory input and all the things that hurt, I put on the noise cancellation headphones, because a lot of sound can be really stuff that other people don't hear, but it just comes in like needles into your head. Put on sunglasses, because light's the other big thing that really hurts. And then I have a fleece hat and a fleece sweater that I wear. Just all the things to start deadening down input. And then I can sit quietly and go through my emails and do other things that are quiet.
According to the New England Journal of Medicine, more than 116 million Americans experience chronic daily pain in America. That's more than diabetes, heart disease, and cancer combined. And it has placed a huge financial burden on society, between $560 and $630 billion each year. That's more than the cost of the entire war in Afghanistan.
What is pain and what is normal pain? Well, simply put, normal pain is essentially an alarm that helps us to adapt to our environment. It tells us about potential harm, or healing, and allows us to respond in a way that protects us and enhances our ability to survive. Chronic pain is when the alarm sensor is broken. And what's important about that is that the difference is the difference between pain as a symptom and pain as a disease.
The thing to note about chronic pain, what really distinguishes it from acute pain, is that it serves no physiologic basis. In other words, acute pain is so good because it's so bad. Acute pain sends a message to us.
Chronic pain can lead to anxiety, fear, loneliness, depression, and even suicidal thoughts.
When somebody first says you look great, it can be extremely dismissing to a person who's been living with chronic pain for a long period of time. And that can actually reinforce a lot of depression that a person feels.
According to the Journal of the American Medical Association, back pain is the most common form of chronic pain, followed by headaches and migraines, neck pain, and facial ache or pain.
Pain is an area that really has exploded over the last 10, 20 years. The management of pain has not only become a higher priority, but our knowledge of how to treat people in pain has increased and changed.
Later in this program, we'll find out how UCDAVIS and Stanford doctors are changing the way they treat pain. But first, what is the connection between the brain and pain? Do we all feel pain in the same way? And can chronic pain actually change the brain?
Traditionally, when people get chronic pain, they often have a hard time thinking clearly. Their memories are not real sharp. Their cognitions tend to slow down, and we often have thought, well, maybe that's due to the fact that they're depressed or they're anxious or they're on medications. We now realize that chronic pain itself can cause fundamental alterations to these frontal regions of our brain that are involved with things like working memory, which is keeping pieces of information in mind. What we're trying to figure out next is, with appropriate treatment, does that reverse? And I think one of the take-home messages here is that we all need to have a little bit more empathy when we hear somebody who's complaining of pain or experiencing chronic pain, and yet we don't see any obvious site of injury. So people need to understand that pain is ultimately a subjective experience.
I had been a lawyer for 25 years, and I was taking a break from practicing law and focusing on my ministry and on my music. I'm a singer and a songwriter, and I was set. I was meeting with producers. I had at least 10 songs of my own that were ready for production and ready for recording. And one of the hardest things about this injury has been it's really painful for me, sometimes talking and all the time singing. And so I have not sung for 11 months.
Today, Tina Green has a difficult time reading, writing, and working on a computer.
In this moment, I open my heart.
Tina wrote this song, but her pain is so severe she cannot sing it. So she turns to the voices of the Davis Threshold Choir and surrounds herself in a circle of love.
In this moment, I open my heart.
I am not my pain. I am Tina Green, a singer-songwriter, an artist, a lawyer, a mother, a friend, a daughter. a sister. I'm all of those things. I'm not just Tina Green head injury person. I think one of the biggest challenges is to accept our limits without letting them define who we are.
You've had such a catastrophic change in your course of life, you don't even know how to proceed. I mean, just this simple thing of putting one foot in front of the other seems overwhelming. And being able to manage that depression, recognizing that this was a big part of my life and my life has changed now.
I have a picture of me when I was 20 years old, and it was a time where everything was possible. I threw all the other photos away of who I was because that was the only thing I could hold on to. And so when I live my life, I really try and bear that in mind, is that whatever this is, whatever the story is about the pain, that my promises to that young 20-year-old, that I'll really make a great life for her. Where you guys going? Come here. Wait for me. Come here.
Part of Victoria's healthy routine and therapy is spending time with her dogs, Comet and Blitzen.
So even if I'm getting in my head, like, how am I going to get through the rest of the day? How am I going to finish work? How am I going to handle it? Or whatever it is, I can just pet them and I find them soothing and supportive and calm. And so it makes a big difference having something so charming and fun around that doesn't require anything of me.
She also manages her pain through exercise.
Depression is an emotional stressor. It's a stress to the nervous system. Whenever your nervous system gets activated, there's a series of changes that occur in the body. Activation of the sympathetic nervous system occurs. A lot of the changes within the body's nervous system can then turn around and worsen the physical pain itself.
You need to have places to go and kind of hide out where you don't get depressed. Little places, great books, sweet movies, loving, supportive friends.
It's set on a door, pain clinic, we reduce the pain. And that's why I kind of figured, okay, then probably there's possible to do it.
First time I took George to Dr. Fishman, he was laying in bed in fetal position. He couldn't get up.
Well,
I had to drive him.
It hurts me to lay on the back, and it hurts me to lay on this side because I had a shoulder surgery. So I always lay on this side and on shoulder in one position. That's very uncomfortable and desirable.
And now look at George. He sits, he walks, he drives, he does everything. And this is all because of Dr. Fishman and his pain medication and actually teaching us to live with pain.
Medicine is split up by internal medicine, pediatric surgery, orthopedics, radiology, emergency medicine, things like that. Pain doesn't fall neatly under any of them. And I was recruited to lead this center with the understanding that we wanted something that wasn't just under one umbrella. The idea is that we're able to provide care for patients regardless of whether they need psychology, rehabilitation, medications, or even surgery.
This progressive approach to caring is also taking place at Stanford Medical Center in the Bay Area.
I think there's great hope in the future for the treatment and management of chronic pain. We are unlocking the mysteries of how nociception occurs, how these signals out in the periphery arise, and how ultimately our experience of pain comes about, how it's shaped by our early life experiences, by our genetics. We're learning so much about that, and as a consequence, we're learning and designing better treatments for it.
Life, hope, desire to live and be able to live. We are able to live a full life, you know, not just lay in bed or on a couch or something like that, but we're actually productive people. George works, I work, and we're almost pushing 80.
Thankfully, George and Rima are managing their pain, but managing pain comes in different doses for different people. Some turn to prescription drugs for pain relief, and that's raising new concerns about a national epidemic of prescription drug abuse. One of the biggest worries is opioid, an opium-like substance.
It's really challenged medicine to look at what is pain relief, and what is misuse, abuse, diversion, and particularly addiction with these drugs.
In fact, according to the American Medical Association, there has been a significant rise in unintentional opioid-related overdose deaths. Between 1999 and 2007, the number of annual deaths increased from about 3,000 to 12,000.
Opioids, right now, we have an epidemic of prescription opioid misuse and abuse. And it's not that the drugs themselves are bad. And it's not that the people who are prescribing them are bad. The problem is that we need to do a better job in educating our physicians and others about how to use these medications appropriately.
Also alarming, between 2004 and 2008, emergency room visits related to pharmaceutical opioids increased from 144,000 to more than 305,000.
The reason we're overusing them is because it's easy to just give someone a pill rather than the multidisciplinary treatments.
For Sean McNamara, a puff of marijuana smoke is more effective than a pill for his feet pain.
Every second of every minute of every day, I feel the pain in my feet. I was diagnosed HIV positive on August 19th of 1991. In 1997, I got a case of shingles on my feet. When I first started feeling it, it was sort of a dull, all-over heat and ache in my feet, and I didn't know what was going on.
He's familiar with traditional medicines, taking pills to treat his HIV and pain in other parts of his body. But when it comes to his feet,
somewhere along in there, I noticed that when I would smoke marijuana, it was helpful. It's been a godsend.
Medical marijuana has a long history. In fact, marijuana was the first, second, and third most commonly used medication in the 19th century in this country.
In 1999, California established the Center for Medicinal Cannabis Research. State-funded studies by Dr. Wilsey and others have shown that the compounds in marijuana do reduce various types of chronic pain.
We have looked at people with nerve injury pain, and we have found that marijuana works.
Dr. Wilsey's latest research could mitigate one of the biggest criticisms of medical marijuana use. He's discovered that marijuana with lower levels of THC, that's the cannabinoid that causes a high, can be as effective as higher levels. Typical marijuana off the street has a THC level of more than 10%. Dr. Wilsey first tested levels of 7% and 3.5% and found that both effectively reduced pain. His latest test goes even lower, as low as 1.3%.
Now, we haven't completed our analysis, but so far it looks as if that 1.3% is yet a better choice in that it will produce less side effects in terms of thinking problems or being high or being stoned.
Pills with certain cannabinoids found in marijuana are available to treat pain, but many pain sufferers have found them to be not as effective as inhaling. Currently, Dr. Wilsey's tests use a vaporizer to distribute the compounds to be inhaled, which is safer than smoking. As the legal and political debate over medical marijuana use continues, dispensaries that once were found in strip malls have been shuttered. While legal under California law, the federal government is cracking down on these dispensaries, calling them a front for marijuana dealing. Dr. Wilsey hopes that science leads to effective regulation of medical marijuana.
This should be an option now in a regulated way, but we absolutely need to do more research.
Meanwhile, patients seeking relief are left in the lurch. Sean McNamara says if he can't get marijuana at a dispensary, he'll find it illegally.
Yeah, I would have to go through the black market.
It's important to relax the body whenever we sit and meditate.
A holistic medicine involves evaluating and encompassing the wholeness of a person in treatments of their various conditions.
The mindfulness-based stress reduction is a program that was developed 30 years ago by John Kabat-Zinn. Today it's used by more than 250 medical centers across the U.S. It's an 8-week program that helps cultivate the mind-body connection. Working on the mind and body is something that Joanne Neff practices several times a week through yoga to help manage her severe arthritis.
There was no way I could sit like this. There was no way I could get down on a floor and up from a floor before I started here 8 weeks ago.
And on the exhale, let your whole spine sink down.
Many people report that they have a much greater sense of control. Their physical symptoms may change a lot or may not change that much, but their perception of pain or suffering around those symptoms often drops dramatically.
But no matter how old or young we are, we all experience pain. But how do we know when a baby or child is in pain?
And children, particularly those under 2 years old, cannot give us a verbal expression of their pain. So we have some limitations in understanding the extent of their pain. So we have to rely on other techniques. And these techniques are visual expressions. So this would be wincing, furrowing of the brow, closing of the eyes.
Little Bailey Wong is about to undergo surgery. She has no idea when she wakes up, she'll have a purple cast on her leg. To help comfort her, doctors will also put a cast on her stuffed doll.
It's perhaps the most fulfilling thing in medicine, is to have an opportunity to help another human, particularly one that is utterly defenseless against what might go on in the hospital.
We first introduced you to Etika Luckett in the beginning of this program. She has ovarian cancer. Etika manages her pain with the help of Dr. Amy Matecki. Dr. Matecki combines Western medicine with traditional Chinese methods like acupuncture. She says it helps reduce the nausea, vomiting, pain, and fatigue of cancer treatments. Despite Etika's cancer diagnosis, Dr. Matecki has helped this professional musician gain strength and courage and live her life to the fullest.
Chemotherapy, it feels like swallowing fire in many ways. By being able to sing and play music, it was like I was creating a healing chamber that was filled with nourishing, positive healing.
Is there either with us or against us?
Positive healing is something Lisa Trujillo holds close to her heart. Her mother and aunt are both breast cancer survivors. Through their brave stories of courage, she came up with the idea to pamper those in pain and called it Day of Caring. Lisa, along with several other stylists, volunteered their time to care for people in pain on a Sunday afternoon.
I'm very happy to be here because I have an 11-year-old and a 9-year-old. And I woke up, I couldn't even sleep last night because I was so excited about coming to have a full day of a spa.
It's remarkable the difference to go from being poked and prodded and, you know, last week it was, okay, lift up your shirt, I'm gonna give you a shot in your stomach, jam, to these healing hands.
What makes it special is it's like a perk of having cancer. You know, friends who don't deal with this, it's like, oh my gosh, you're so lucky to have this day. Like, yeah, but look what I had to go through to get this day.
I'm holding up pretty good. I've had my ups and downs, and not being able to go to work on the days I feel good is very bad because I'm a very active person. It makes me realize that I'm still able and should enjoy things in life.
Throughout this program, we've met many different people from all walks of life who share a common bond. They all experience chronic pain. But doctors say there is hope in the future for those living with pain.
I found that we can actually help turn this around. And I'm convinced that by spreading these messages, by helping to educate people, we can spread this knowledge out there so that more people can ultimately benefit.
To order a DVD copy of this program, call 888-814-3923 or visit KVIE.org. Presentation of this ViewFinder episode is locally supported by UCDAVIS Health System.